You want to come in the picture a little more? I think it's working. It looks like it's working. We don't know. If anyone is in here and can tell us if you can hear us, if you can see us, you would do us a big favor right now.
Welcome to my room.
Welcome to Rita's room full of plants and books. Okay. Hi, guys. Let me ask on my Instagram if people can see. This looks like a live stream to me, but oh yes, we have a thumbs up. There you go. Does that mean that people can hear us? Great. Sweet. So hi everyone. Thanks for tuning in to this live stream. The reason why I want to do this live stream is because I often get medical questions in my Instagram via DM from you guys. And although I kind of know the answers, but because I'm not a doctor, I'm not a medical practitioner, et cetera, I feel a little uncomfortable answering them. And I have this amazing friend who is a medical nurse practitioner, and I'll let you introduce yourself in half a second. And so I thought, what a better way to answer your questions, get a medical opinion, doing this live if you guys have any questions, et cetera, et cetera. So Rita, I think people have seen you in one of my videos, but reintroduce yourself just for the sake of new people.
Yeah, so thanks for having me, Lorene. And my name is Rita Anderson. I'm a nurse practitioner, family nurse practitioner here in New York City, and I work mainly in sexual health. And I've worked in different settings. I worked at Planned Parenthood. I work at the Department of Health now in our STD bureau. But just caveat, this is not endorsed by, so I'm speaking as an independent provider. But yes, I work in sexual health. Yeah. In an STD clinic.
Good caveat. All right, so the way we're going to do this is I received a lot of questions from you guys, and we want to make sure that we don't drag it and we don't get lost in information, but we really give you guys answers. So I'm going to use my phone to time our answers, and we have maximum 2 minutes to answer some of the questions that we received from you guys. If you guys have questions, we'll give priority to people who are on the live stream, so we'll answer those questions more than the questions that we received by DM. So feel free to leave in this chat your questions, but if not, we're just going to start with shedding. So what is viral shedding, and does it occur? Well, let's start with that. What is viral shedding?
So great question. Viral shedding is when the virus lives.
No pressure. Yes.
So the virus kind of lives in our nerves in different parts of our body, and it's usually kind of like sleep almost. And then a couple of days a month, it kind of wakes up and little microscopic particles of the virus shed through our skin. Mm-hmm. And
so that means that when you have your genital area, there's particles of skin that leave your body, and that when they come into contact with another body's genitals or mouth or eyes, there's a risk of transmission. So that means that herpes is not just transmittable in the times where you have visible sores, exactly, but it is transmittable even outside of those times. Do we have any number of how many days per year or per month do people shed according to if they have HSV 1 or 2?
Yeah, so for HSV 1, they think shedding happens around 10% of the year. So we calculate it's a couple of days a month, but it's random. We don't really know when that's happening. Mm-hmm. And then for HSV 2, it's a little more. It's about 20% of the year we can be shedding. And even if you've never had an outbreak in your life, mm-hmm, you are still shedding.
Okay, and I think we came across this this link from the CDC that was saying if you are experiencing symptoms, if you're having outbreaks on a semi-frequent basis, then your viral shedding will be more days per year than if you don't have symptoms. But even if you don't have symptoms, you still do shed, I guess.
Mm-hmm. And that's another reason why herpes is so common, because even if you've never had an outbreak, you're still shedding. So most of us have come into contact with the particles.
And that's 2 minutes.
Woo! Woo!
Damn. Okay, I like this. So if someone has HSV1 genitally, does it mean that they have it orally as well? And I guess it works the same way. If you have HSV2 genitally, does it mean that you have it orally as well?
That's a great question, but no, it doesn't mean that. So before they used to think HSV1 was only oral and HSV2 was only genital, but with the rise of oral sex and rubbings and things like that, which, we love oral sex,
Yeah.
the particles, if they shed, for example, if you have HSV1 on your genitals, then it can shed to your partner, to the partner's genitals, for example.
Mm-hmm. So basically, when you test positive for either HSV1 or 2, you test positive in a certain region of your body. You don't just test positive and like you can start having outbreaks anywhere. The virus, I think, pops up where it enters your body. So if you contracted it on your genitals, you will have symptoms on your genitals. Now, caveat, I think you can also auto-contaminate yourself. Like you could potentially give yourself, like if you have, let's say, cold sores, and you touch your mouth, you touch your sore, and then, I don't know, you masturbate or you happen to come in contact with your genitals and itching and stuff. Or sex toys, you could potentially give yourself HSV1 to your genitals. So in that sense, it's possible to contract it in different places, but usually if you test positive for one or the other, it will manifest itself where it entered.
And there's a really cool, interesting other type of herpes called Herpes Gladiatorial.
Oh my God, yes.
Have you heard of it? And they call it gladiatorium because like wrestlers get it sometimes in high school, but you can actually get lesions anywhere technically on the body. Sometimes like health providers, we can have them on our hands from touching things. I mean, we should be wearing gloves, but technically, yes, it's wherever the little particles enter the skin is where you can get an outbreak.
Cool. Under 2 minutes again. We are on a streak. Okay. So how about we move to suppressive therapy? What is suppressive therapy? It sounds like a big word. And the things that I'm looking to answer here is suppressive therapy a method to reduce the likeliness to transmit the virus to 0? Or is it something that is like suppressive to a certain extent, but not completely suppressing?
Yeah, that's a great question. A lot of our patients ask us about suppressive therapy. So suppressive therapy means that you're using medicines, antivirals, that basically are suppressing or not allowing the virus to make copies of itself and then to cause outbreaks.
Mm-hmm.
So it's very effective. There's different ranges of how much it's reducing risk of your own outbreaks and transmission.
Mm-hmm.
But yeah, CDC does recommend, if we kind of say maybe if you're having like, even for yourself, like an outbreak a month, every other month, it's really bothersome, you can try suppressive therapy to help your own symptoms and then also to prevent transmission to partners.
Yeah, I heard that suppressive therapy was recommended if you're experiencing like more than 6 outbreaks a year. So like even if you have it every other month or more frequently, then suppressive therapy might be something for you. But something else that I often get from viewers is like, as soon as they get tested for herpes, they're like, I'm going to go on suppressive therapy, et cetera, et cetera. What I did and what I recommend people to do is wait. I know it's easier said than done, but wait like 6 months to a year to really see how the virus plays out in your body, because chances are that you're not going to have an outbreak after your initial outbreak. Most of all, if you have HSV1, which is known to present itself better or more frequently on the mouth. But if you have HSV1 genitally, then you're not going to have as many outbreaks than if you had HSV2 genitally, right? Mm-hmm. Buzz if I say anything incorrect. But what was I saying?
Suppressive.
Yeah. So if you, according to the virus that that you have, you might want to wait how often your body gives you symptoms and makes you deal with outbreaks, because chances are you're not going to have another outbreak, or you're going to have like maybe 2 outbreaks a year, and then suppressive therapy is just basically not going to be as needed for your body. Ben says it's $300 a month, which is...
There's a really good website called goodrx.com, and you can put in your zip code, and you just need a prescription from your healthcare provider, but you can go HSVRx.com. You put in your zip code and the medication, and it shows you a list of the best places to get the cheapest medicine and a coupon that you can print or bring in on your phone.
Don't we love Rita? Don't we love Rita?
Yeah, but it works for any medicine. But you just need a prescription from your healthcare provider.
We're over 2 minutes, but that was for a good cause.
Yeah,
yes.
The last thing I wanted to say was also your immune system is a huge suppressive force. So I always recommend friends and patients to do things that help keep their immune system strong, because that's going to suppress the virus too. Exercise, stress reduction, sleeping well, and
Yeah, and Jan just said, is it also not decreasing the shedding rate? It is. Like suppressive therapy is lowering the frequency of outbreaks, the severity of outbreaks, and something else. Is it like the duration of an outbreak?
Mm-hmm.
So instead of like lasting for a week, it might last like for 4 days or so.
Mm-hmm.
Hi from Argentina. Hi from New York.
Hola.
Hi, Deborah. So let's keep going on viral shedding. A lot of people have asked, so once you start suppressive therapy, how long should you wait to start having sex and for the suppressive therapy to be in effect? So for having those, you know, to keep the virus dormant, is it like a couple hours, is it a couple days, a couple weeks?
That's a good question. I would probably say a couple weeks, see how your body responds, and see how well it works for you. Because sometimes people, even on suppressive therapy, they still get outbreaks.
Yeah.
So you kind of want to see how your body responds.
Mm-hmm. So usually the rule of thumbs is, like, if you had a patient, you prescribe them, you know, or you recommend them to get on suppressive therapy, you would tell them, like, wait a week?
Maybe a couple weeks.
A couple weeks?
Or, yeah, we wouldn't necessarily even say wait to have sex.
Mm-hmm.
We always do recommend avoiding sex during outbreaks, because also your skin is open, so other things can come into your body.
Mm-hmm.
And in general, we recommend avoiding sex during an outbreak. So if they're starting suppressive therapy but they don't have outbreaks, they don't necessarily need to wait.
Okay, that's clear. So suppressive therapy is like, you take this drug, which is usually valacyclovir, acyclovir, famciclovir, Zovirax. Like, there's multiple names for like the actual medicine versus the generic one, but there's also like alternative medicine or more natural things that you could take to either keep your immune system up, or like certain things in our foods that might trigger our nervous system, etc. Do you have, like, for example, I take lysine, and there's people who have asked me, is there any like medical research that proves that lysine is indeed effective? So what's your opinion on that?
Yeah, I love natural medicine, nutrition, things like that. As far as I know, we don't have a study showing the effectiveness of lysine, but I don't think it would hurt. And I think the recommended daily amount is like 1,200 milligrams a day, and then you can increase it during an outbreak. But yeah, I mean, I think if you want to try it, it wouldn't hurt.
Yeah.
But in terms of effectiveness, we don't know.
Yeah, I think the trick. Hi Nicole from Canada. Oh my God, this is like a global, international live stream. I love it. In terms of what these things do, I personally also take things to keep my immune system up, like oregano oil. I take oregano oil, which I have just started about like 10 days ago. So I'm not going to do a video until I do it for a few months and see how it plays out in my body. But in terms of natural things that you could take, there's echinacea, there's oregano oil, which are proven to, help your immune system stay up, because we know that herpes outbreaks are triggered when your immune system is not so strong. But in terms of lysine, I have a link that says like the foods that are high in lysines and the food that are high in arginine. Is that what, like, the thing that you should avoid is arginine. The thing that you should go for is lysine, which I will post in this stream, so you can understand like what you should go for or avoid when you're cooking at home or in restaurants.
Also, sun exposure could trigger outbreaks for some people. Yes. You can kind of see like what does it for your body.
Mm-hmm.
What foods, if anything.
Okay, so do you know any statistics around the chances or the percentage of likelihood of transmission from genital to mouth or from mouth to genital? Like, is it easier to pass it from, someone who has cold sores to genitals or vice versa? Or is it according to the type of herpes that you have? Like, can you give us a little bit of an overview of how that whole thing happens?
Yeah, I mean, because shedding for HSV2 happens like 20% of the time versus HSV1 is about 10% of the time of the year, I would say that there's more time percentage chance that HSV2 can be transmitted, but because we're in contact so much more with people's mouths and things than their genitals, then oral transmission is probably more likely oral to oral. But in terms of
oral to oral, okay. Yeah. And that's interesting because that's often not considered as like, oh, I have herpes. Like if I kiss someone who has cold sores and I get cold sores, I'm not going to feel so bad as if I get it on my genitals, but it's literally the same virus contracted from the same person.
And the really interesting thing that I learned is that most adults or most people get HSV1 during childhood, which I didn't know. So even before you kiss people or have oral sex or anything, we're already exposed through sharing toys in daycare, slobbering, family members kissing us, unknowingly. So that's kind of nice.
Yeah. So basically the way it happens more often, and I read this stat that said that 50% of new cases of genital herpes, so meaning herpes that happens on genitals, come from HSV1 because people are performing unprotected oral sex. So I guess what we're saying is there's not necessarily a better likelihood to transmit, whether it's HSV1 to HSV2 or mouth to genitals. It's more according to the type of sex that you're going to have.
Exactly, yeah.
And because more people have HSV1 than HSV2, it's likely that you could contract HSV1 either on your mouth or your genitals from kissing or oral sex.
And just another little, how are we on time?
It's okay. We answered other questions in less than 2 minutes, so let's use extra time.
Yeah, as you know, I work in an STD clinic, and a lot of times we forget about oral sex as a route for transmission of other STDs, like chlamydia, gonorrhea, syphilis, hepatitis A, if you have oral to rectal contact. So just something to keep in mind too. And things aren't 100% transmission rate. So, just because maybe you have oral sex with someone who, has cold sores or, lesions in the past, not currently, it's not like the 100% transmission rate.
So some people have asked, why on earth is HSV incurable? There's like literally 3.7 billion people in the world, which is like 2/3 of the world population having herpes, either HSV1 or HSV2, and there's no cure. Why?
Yeah, that's a really good question. And so the other viruses too, HPV, HIV, they haven't figured out yet how to kill the virus. So viruses are different from bacteria, and they're very smart and they're very fast replicating, and they're really tiny. So versus bacteria, with antibiotics, we can literally kill their structure and they die. But viruses, the structure is really different. So
is gonorrhea a virus?
Bacteria.
A bacteria, because I read things that say that gonorrhea is becoming increasingly it's shifting, and it's really hard to
with resistance.
Yeah, exactly.
Yeah. Luckily, we haven't seen much. We haven't seen like the super gonorrhea in the States. In other countries, but actually there's health organizations that are tracking this resistance, but it's still curable with medicine. You just need a lot of it.
Okay. And where does herpes live in your body? Like you contract it, let's say, on your mouth or on your genitals, and then what happens? Like, why is it popping up sometimes, and like, where is it?
Yeah, so it's very interesting. So herpes, the virus, lives on our ganglia, which are the connections between our nerves. And so, for example, the virus travels up through your skin, up the nerve, and then it kind of hangs out in the end of the nerve. And then, for the oral herpes, it's kind of around our cheeks, like the nerves are just connected to our spinal cord in the back. And then genitally, the virus kind of travels back, and it kind of sits in the base, near the base of the spine.
That little fucker.
Yeah.
Just like
he
traveling all the way back.
And then with stress, with different things, it wakes up, travels down the nerve, and pops out onto the skin.
Ian, you asked if people with HSV1 orally also shed when they don't have sores, which is like one of the first questions that we answered. So the short answer is yes. And then when I'll post this live stream on my channel, you can go back to the beginning of the live stream where you can have all the more detailed information. But the short answer is yes. So let's see. So does genital herpes affect both vaginal and anal area?
Yes. So, and we see a lot of anal herpes at work, but and it can also be not only on the outside, like around the anus, but also inside the rectum. So you might not see your sores, but you might feel like burning.
Yeah, let's talk about that actually, because that was another question. Can you have internal sores, and what are the symptoms in those cases?
Yes, so you can definitely have internal sores, and a lot of it is like you could feel burning, tingling, feeling like you have to go to the bathroom. You might even notice a little bit of bleeding. And actually at work, if people are having sort of like persistent rectal burning, we could do a little swab inside the rectum, and a lot of times it's positive. Okay.
And is that true also for the vagina? Like, could you have sores inside of the vagina for women?
You could. But that with the speculum, we could look inside and see. Usually I haven't really seen almost any sores inside the vagina.
Okay.
But I see tons on the outside. But you can definitely have sores inside too.
Okay. And for men, is it the same thing, like inside the urethra?
Technically, they could. They could have sores inside the urethra, but we don't see it that commonly. But they could do a little swab inside to check if someone's symptomatic.
Okay. And also something else about this question that I just asked about vagina versus anal. I feel like most of all for women, because when we go to the bathroom, we tend to like always use toilet paper and, wipe our genitals after peeing or pooping. And that can also probably like carry a little bit of either particles when you're shedding or actual like liquid, like fluid when you're having symptoms.
Yeah, if you have an outbreak.
Exactly, which might unfortunately like increase the area where you're going to be affected with outbreaks. So it's definitely something that can happen.
Yeah, just be mindful when you have outbreaks and try not to touch them. Or if you touch them, wash your hands so you don't spread them.
So how does one go about getting tested for HSV-1 orally?
So the testing is a huge question, and it's a really good question. But so the most accurate tests are when you actually have a lesion, and we can do a swab. It's called PCR test, and we can actually detect the virus. So that's the most effective. Okay. The most accurate.
So do go to your doctors whenever you're having like an actual symptom and you're wondering if it is HSV-1.
Yeah, like if you've never had an outbreak before and you have, a painful sore on your lip and you want to know. The only thing is about after 2 days of seeing the outbreak, sometimes the test won't pick up the virus anymore because it starts to heal and the particles are kind of dying. So if you can, it's always good if you can to try to go within 2 days of seeing the sore for the most accurate test.
Okay. And then if you don't have symptoms, like if you're just curious, or maybe, you've recently been with a partner who knows they have cold sores and you want to check yourself and see if you can contracted it.
Yeah. So with the testing, for some, so the blood test it can check for HSV-1 or 2, but it doesn't tell us when necessarily someone was exposed. And if you have a positive test 1 or 2, it doesn't predict if you're going to actually get outbreaks. Most people have positive blood tests and they won't get outbreaks. But your blood test checks for antibodies, which take time to develop after exposure. So if you are exposed, maybe your blood test might not actually turn positive for a couple weeks to even like 4 to 6 months.
So the first thing to do would be to do a swab if you're having a symptom. That's like the fastest and most accurate way to have an answer.
If you have a lesion.
If you have
a sore.
If you don't have a sore, then you should do a blood test, but you should wait a certain time period.
So it's a good question. Like, should I get a blood test or not? And people have different opinions about it. But for example, if one partner does get outbreaks and the other partner has never had them and they want to know if they already have herpes or in their blood, so in their body, they can test. And they say the most accurate time to test would be about 12 to 16 weeks after exposure.
12 to 16 weeks.
So it's like 3 to 4 months after exposure.
Oh, holy smokes.
So it's a long time, but that way, because if you test before that, your test might be negative.
Okay.
But
and between that time period, your test is likely like, what's the rate of accuracy?
It depends on the person. So we're not sure.
More or less,
some
like,
people.
Is it 90%? Is it 50%?
I wouldn't say 90%.
Yeah.
They do say it really depends on the person. Some people, their blood test will pop up in a couple weeks, but some people won't for 6 months. So.
Okay.
But but I mean, you could always do the test just to know your baseline, even in the past. Like maybe you were exposed from a previous partner.
True. Is there a way to tell how long you've had the virus in your body?
No, not really. So some people, so there's 2 tests for antibodies, IgG and IgM.
Yes, let's talk about that actually.
Yeah. So it's interesting. So IgM usually pops up in the beginning of in a new exposure, but then it goes away. But an IgG kind of pops up later. But the most accurate blood test is IgG because they found that IgM is not reliable for, it's often false positive or false negative. So I was even reading that it's good for providers not to even test IgM at all because it's not really accurate. It doesn't tell you how long you've had it, even though some people think it would tell you.
Yeah.
And then also IgM can pop up frequently positive on a blood test with recurrent infections. So if you see positive IgM and you say, oh, I just got it, it's not true because it can pop up when you've had future, like subsequent outbreaks.
Okay, so what I'm taking away from all of this is that all this stuff is really complicated. The medical industry also has a hard time like pinning down with accuracy, like if someone is positive, someone is negative, how long they've been positive for, where in the body the virus is located. Actually, that's a good question. Is there a way to tell, like, if I test positive for HSV1, but I've never had any symptom, is there a way to tell if I'm positive on my lips or on my genitals?
No,
not that even.
Because it only looks for antibodies. So it's only like, has my body seen this virus before or hasn't it? Not where or even if you'll ever get an outbreak. Okay.
So how about we do a little pause? We have now 20 people on this live stream. Feel very popular. Do you guys have any questions for us right now that we haven't touched upon, or maybe we have touched upon it, but you would want a little more detail? We're free to, oh look, I started the Instagram live stream. We're like live from I don't know how many different places. Guys,
luckily I cleaned my room today.
If you want to hear more about all the stuff that we're talking about, make sure you tune into the live stream on my YouTube channel. There's the YouTube link in my bio on Instagram. We're almost done. If you guys don't have more questions. Oh, let's see. When you had your first outbreak, what were your symptoms like if you've had one? So when I had my first outbreak, I felt like fever-like symptoms. Like it was not just so first of all, let's talk about genital-wise. I felt like something wasn't right. It was swollen. It was painful when I peed, which initially I thought I had a UTI, but then I understood that it's because there was a lesion. And so when pee came in contact with the lesion, it was actually burning. And then I had, fever-like symptoms. I think it lasted for at least like 5 or 6 days. And that's when I knew that like something really, really wasn't right. Now, I don't know if I had the virus like prior, like years before. And I think that's something else that the medical industry doesn't know is what provokes the first outbreak? Like, how can the virus go from like dormant to active all of a sudden? So that's a question that I haven't been able to answer, but those were my initial symptoms. And then for the following outbreaks, the symptoms were, there was no fever-like symptoms, flu-like symptoms. It was only tiny bumps or lesions that would appear typically where I had my first sore.
And a lot of times the first outbreak is so small that that people don't even feel it. So maybe you've had an outbreak, one has had an outbreak, and they didn't know it was, and it can heal really quickly.
Next question. I had someone tell me there were different stages of the virus and that HSV1 could cause a type of throat cancer. I don't know if it's cancer, but you could have throat. Could you have throat herpes?
I haven't, probably, technically, yeah. I haven't heard of HSV causing cancer.
No.
HPV,
yes.
human papillomavirus, definitely can
yes.
cause oral cancer,
yes.
penile, vaginal, anal cancer. And
throat cancer too, I think.
Yeah, throat, oral.
The thing that HSV might facilitate is contracting HIV, because when you have lesions, like your skin is basically open, there's a little bit of your skin that is open, so that facilitates other viruses to penetrate your body, but no cancer that I heard of. Is there any harm? Does it matter if you take suppressive therapy right after diagnosis? My doctor put me on it right away. So we discussed that initially in the beginning of our live stream. What my doctor recommended, and which I kind of agree with, is to see how the virus plays out in your body and see how frequently you're having outbreaks in the first place, because you might just be experiencing one outbreak and that's it. Before you go on suppressive therapy, because is it harmful to be on suppressive therapy for like years? Could someone be on it for like 20 years, or is it recommended to have periods of detox from suppressive therapy?
What we usually recommend is try it for 6 months if you're going to do it, and it's good to get certain blood tests first, like liver tests, to make sure that it's safe for you to take the medicine. But yeah, you can try for 6 months, and then they repeat those blood tests, check in, see frequency of symptoms, and then, but yeah, usually after a year, people reassess.
Mm-hmm. How do you start dating after you found out you were diagnosed? Rebecca, welcome to my channel. You are at the right place. I have tons of videos on my channel where I talk about, dealing with rejection, which happened. It happened before I contracted herpes, but it also happened following a herpes disclosure. How to tell your partners that you have herpes, how to approach online dating, etc., etc. There's a lot of material that I think you will find helpful on my channel.
I just want to say, yeah, Lorraine's videos are awesome, and I recommend them to all my patients. Mm-hmm. And I think a big thing is education and information. Like, a lot of people are afraid of herpes and HIV because we don't know. Maybe they don't know how it's transmitted, what it does to your body. So I think education is awesome. Her videos, cdc.gov, nyc.gov, STDs. So if partners are informed, they'll hopefully be less stigmatizing.
Yeah. And that's actually a good segue into the next question that I want to answer from Lada. What is your plan and ways of preventing your partner from being exposed? What are y'all's routine for sex, etc.? So obviously, not teaching anyone anything new, but using condoms. Although herpes is a skin condition, so using condoms might reduce the risks of prevention according to where the sore is located. It will not completely eliminate it. With I guess with HIV, it completely eliminates it when you use the condom correctly, when you put it correctly.
Well, we would say, with HIV it's a little different because, if the condom slips or breaks or something. But
right.
But yeah, so for HSV, it could be, the particles could be on your skin. So if the condom isn't fully covering the full area, then yes, it could shed.
Yeah, that's what I'm trying to say is with HIV, it's vehicled and transmittable via sexual fluid. So if you can contain that fluid, then you're fine. But with HSV, which is herpes, it's a skin condition which might live outside of that moment where you ejaculate or where you are secreting fluids. So in that sense, condoms, yes, rule of thumbs, always use condoms. Also because there's all this stuff that more endangering to your health that you might be exposed to or might be exposing yourself to. So condoms, yes. Second is suppressive therapy. If you're on according to the frequency of your outbreaks, if you experience like even just 5 or 6 outbreaks a year, you might want to go on suppressive therapy, which is something that I have done to reduce the frequency, reduce the duration. But mostly what I think is like killer is communication, like telling your partner, hey, I feel like there's something that is not right. I don't think we should be intimate today and probably for like the following week. And, partners appreciate that type of honesty, obviously. And then, if you feel like taking the risk, because let's be honest, it's not just like by the book. Like there's also times where you're in the moment, you don't care, your partner doesn't care. Like it's up to you two to decide what to do with that information. But in terms of prevention, I always keep in check and keep the conversation going with my partners, being like, hey, I feel like something's not right, or I didn't get a lot of sleep in the past week, and I feel like something might be popping because I've had it now for 5 years and I know what triggers it in my body. Like usually it's either lack of sleep or menstruation. So I just like, I'm really in tune with my body, and I communicate it with my partners.
And if you guys have been together for a while, if the partner wants to get those blood tests to see if they've already been exposed, then if they've already been exposed, then they're already exposed. So, because once people are together for a while, fluid, skin, everything's touching and people are passing things to each other. So with new partners, it's a little different. But if you've been together for a while, the partner can see if they've already been exposed.
Mm-hmm. So Vanity Faye is talking about a friend of hers that was diagnosed with herpes, and she eradicated the virus through proper diet and antiviral herbs. She received negative test results 2 months after having an outbreak and positive results. Personally, I'm always a little bit skeptical around people who say I've eradicated the virus, just because even when you have the virus and you test for it, you might test negative when actually you are positive. Like the testing method is a little bit like approximate already.
False negatives.
Exactly. There's false negatives. There's also false positives I've heard. So whenever people use the same methods to prove that they've eradicated, when those methods aren't even effective 100% to diagnose, then I'm always a little bit skeptical around, maybe you've successfully put it in a dormant condition, but have you actually like eradicated it? I'm not sure. Also, I'm not a doctor. I'm not a researcher. I'm not, trying to find a cure for herpes because I'm not qualified for it. So
maybe in the future, like I don't underestimate the power of plants. I think plants are incredible medicines, and I hope that we have more research into natural and plant medicine. As of now, I don't know of any cure, but I would love to see that in the future.
Mm-hmm. All right, I think we are reaching our time also because someone has a brunch date over here. But thanks to everyone for tuning in. And, I will post this live stream on my channel so you can go back to it. I will also make sure to put in the information bar like links to useful website that we've found with, stats that we've mentioned, et cetera, et cetera. And my next video is coming up on May 28th for Menstrual Hygiene Day.
Woo!
So make sure you
Menstrual
check it out.
cups.
Yes, and discussing like different types of birth control.
I just want to say, I think sex is amazing and beautiful, and we wouldn't be alive as a species without it. So, yes, less stigma, more education, more sexual pleasure.
There you go. If you had a nurse practitioner like Rita, when you go get tested, like it's also, I feel like there's a little bit of stigma around, if I go get tested, I'm going to be judged, and the nurses and the doctors, et cetera, et cetera. But those people are just people like us who have sex, like us, who have likely to have had some, missteps in their whole like sexual journey. So there's people like Rita who are sex positives and who won't judge you for wanting to actually be responsible and maybe having contracted something. So if you are scared of getting tested, try to get beyond that fear, because it's important. It's important for you. It's important for your partners, et cetera, et cetera.
Yeah, and if you have providers that do disrespect you or your gender identity or your sexual orientation, which we hear a lot, that happens a lot, I would say, if you can, don't go back to them, because they're probably not giving you the best services, and try to find services and providers who respect you and have the proper test for you.
Yeah. All right, guys. Happy Sunday. Thanks for tuning in. Bye.